Welcome to the doc2doc podcast. I'm Rob Hoyer, medical oncologist.
And my name is Abbass, gastroenterologist. This is a podcast about lifestyle medicine, disease prevention, and longevity.
This podcast is provided for informational purposes only. It is not medical advice. Please consult your physician for personalized therapy and advice.
Our goal is to enable individuals to become CEO of their health by managing their diet, exercise, sleep, and stress to prevent common disease.
Hi, everyone. Welcome to today's podcast where we'll be talking about the metabolic syndrome. We'll start out with a definition and overview of this condition, talk about some of the risk factors and the prevalence of this in the United States and worldwide, and then talk about some of the diseases that are associated. And we'll close up the discussion with some discussion about how you can prevent and reverse this condition with lifestyle changes. And we're talking about this today because this is one of the most important conditions today, in our opinion, that it's associated with many of the diseases. And so, in terms of looking at first principles or root causes, metabolic syndrome is really one of the keys to really understand why a lifestyle medicine approach is so powerful. So we'll start things off with the boss discussing definition and overview of metabolic syndrome.
Thanks, Rob. Metabolic syndrome represents a combination of cardiometabolic risks determination, including obesity, particularly central obesity, insulin-resistant, glucose intolerance, dyslipidemia, non-alcoholic liver disease, which is rapidly increasing prevalence in the worldwide, especially in Western country and US. Today, at least 1/3 of the population suffering from a range of this metabolic syndrome, and soon to probably be about 50% of the population. Historically, when you look at history, this gained popularity in 1970s and 1980s, and since then has been gradually increasing. In the past, in early 1900s, there has been a discussion about a combination of hypertension, obesity, and glucose or kidney disease. In 1947, this was more defined as a serious medical issue, which included conditions such as diabetes, kidney disease, including hypertension, hypercholesterolemia, as well as elevated uric acid that can cause gout. Later on, this has been associated with high triglyceridemia and further complication with coronary artery disease and stroke. So, as today we'll see, majority of our patients suffer from a combination of at least 2 or 3 of this disease. But however, as this progressed on, then they cause severe disease such as sleep apnea, coronary artery disease, stroke, initially with gastroesophageal reflux disease, as well as difficulty managing the diabetes as well as cholesterol.
So, boss, when I hear you talk about the metabolic syndrome, I just keep thinking that this is a condition that seems relatively recent in human history. If you look at the last 100 years or so, maybe 150, the industrial age and how we started living in cities, working in factory jobs and more sedentary type work over the past 20, 30 years with the information age. It just seems like something that's pretty new and really something that we haven't seen in human history until this modern time in which we're living. What do you think about that?
You're absolutely right. If you look at human history, can go back to, in a way, modern civilization, or there maybe 18 to 10,000 years ago to present times. Majority of the time, people has been working in the farm, or if they were stone workers with uh, adequate nutrition to support their daily life, and has been several famine throughout the world. However, since the industrialization of the world, particularly since World War II, which food industry has become more uh, expanded to people try to people eat outside and eat prepared food and then cooking at home. This has been gradually increased. If you look at the history of diabetes, obesity, this has been increasing. Today we see a good example is possibly Middle East. If you look at for past 30 years, since the beginning of the Persian Gulf War to today, in Dubai, Qatar, and Kuwait, you see significant obesity since the fast food has found its market there, and with sodas and fast food, the obesity and metabolic syndrome is rising quite a bit. And I think, of course, during this time, with the invention of the automobile and TV and lifestyle changes, and not working in the field as well as getting daily exercise, most people become office workers or work at the computer. And today, WHO consider uh, the an office sedentary life is as bad as smoking for your health. So I think it's a combination of the lifestyle as well as food preparation, and not being outside or working in the farm, or getting adequate exercise. This has become a more and more a problem. One of the example is in Okinawa, Japan, that people they still live their ancestral lifestyle in the mountain. They have a very longevity, but people they live around the American bases, which abundant of the processed food and different lifestyles of working in offices, the number of the cancer as well as obesity, hypertension, and decreased life expectancy is pretty obvious. So yes, unfortunately, this is as we change in the food calorie, whether it's wheat or corn, or change it to more of increasing shelf life and abundance of the carbohydrates. And this has affect all our metabolism, and consequently, these are what we're suffering today from.
Thank you for that. It's something I've observed, and I know many others have as well, about how we live today and how the just some of the defaults about sleep, or lack thereof of sleep, a lot of screen time, going outside less, processed foods. This has created this really a toxic brew, if you will, of lifestyle factors that, in my opinion, have all combined together. And in order to really break this cycle, it's important to first you have to understand it. I think that's really important. And we'll get into here some of the risk factors. So this is just we're just going to go through some of these risk factors, recognizing this is this metabolic syndrome, as it's called, is a variety of different things, and it's a really we're this is not a disease per se. We're just describing a a, a series of symptoms that are associated with this condition. The each of these conditions is itself a disease that, but they all together comprise this metabolic syndrome. So yeah, we can talk a little bit about the risk factors. And so the first one is high blood pressure. So that's the first one, and that's something that we see very, very commonly. Associates with It also associates with being overweight, eating a diet that's too high in sodium. So this is really important. So one easy way to start combating metabolic syndrome is to reduce the salt in your diet. Ideally, less than 2 grams a day. That's actually really hard to do if you're eating any processed food, because the the processed food, by definition, to taste good and to have a shelf life, has a lot of salt, and that all that salt is what it does is this has been shown conclusively. It gets into our blood vessels and actually contributes to hardening of the arteries, which leads to high blood pressure as we get older. And if you are overweight and have other and you can and other risk factors, probably high cholesterol, other issues, can contribute to this elevated blood pressure, and which then leads to a whole slew of other problems with risk of heart disease, stroke, and other. So getting the salt out of the diet, reducing processed food is a great way to start combating blood pressure. Decreasing weight as well is something that's important. The big one, the second one, which is I think the biggest one, is the insulin resistance. And this is something that when we eat, blood sugar will go up. That's normal. But the degree and time that it's elevated is really important. So when we see an individual with insulin resistance, their blood glucose will spike, and it'll stay high, and then it will slowly come down. And just a couple of thoughts about this. One of the ways to help this is to lose weight. So by reducing the number of adipocytes or fat cells in your body, you can help reduce this insulin resistance. That's a great way to start. Eating less often is really important. So eating um, uh, two meals a day, or you can do the 3 meals a day. You just got to watch what you're eating with those meals, but trying to avoid big glucose spikes is something that can be helpful. Intermittent fasting, and we're going to have a whole episode on this in the future about intermittent fasting, and we'll talk about what that is and how to do it. I've been experimenting with a continuous glucose monitor, and we can talk a little bit about that down the road. I'm still gathering data, but I must say it's fascinating to see how much my blood glucose spikes after eating breakfast. And I've actually started eating two meals a day, breakfast and dinner. That's the current iteration. I may go to a different pattern, but we'll have to see how this goes and try to vary it around and see how that works. But it's fascinating to see your blood glucose real time. Central obesity is something really interesting. So obesity around the waist, central obesity, kind of a apple shape to the body or pear shape, is closely associated with the metabolic syndrome, and it's something that it can be. This is the hardest weight to lose, is right around the gut, the love handles, and so I've been experimenting with that recently about trying to do the fasting and other calorie restriction to try to see about losing that. So I'll report back how that goes. High triglyceride levels are also associated with the metabolic syndrome. So that's probably related to diet. So the biggest one, sugar and processed carbohydrates like white flour, other processed carbs are going to be the biggest contributor to high triglyceride levels, and that is also associated with metabolic syndrome. And the other one is low levels. The fifth risk factor is low levels of high density lipoprotein, or HDL. That's what's known as the good cholesterol. That type of cholesterol can be raised by diet and exercise. So the most important things with the HDL. So it's this constellation of different factors, and it's not one thing. But it's kind of interesting. It's like different. There's can be different amounts of each of those five risk factors, and that can determine whether or not you have the metabolic syndrome, or to what degree you have it, and then to what degree you may develop all the diseases associated with this condition. There's a really good slide, and we'll link to this on the show notes, about metabolic syndrome, the risk factors, and then it has all the diseases, including which can be associated with this condition. I'm just going to pull it up here, and it talks about all the different conditions that are associated, including neurologic disorders, cancers, uh, di- diabetes, and a variety of other conditions that are stroke. And we'll talk about those in a few minutes, about the different conditions associated with the metabolic syndrome. As far as the prevalence, it is unfortunately increasing. A lot of this data we get in arrears. We get it after the data has been collected, and maybe it's usually about 10 years or at least 5 years delayed. That's normal because the data has to be collected and collated. So it's rare to have a, immediate snapshot. But as of 2012, we were able to there's a study here um, by the from the National Health and Nutrition Examination Survey, showing about a third of adults in the U.S. Have the metabolic syndrome, increased from 25.3% to 34.2% prior uh, prior to um, prior to 1994. So from 1998 to 1994, it was about 25%. In the 2007 to 2012, increased to 34.2%. So this is really a huge issue. 1 in 3 adults, also kids, are now being affected by this, and so this is something that it's become. I think we're in a situation where what we call a disease is by definition something that affects less than 50% of the population. This is affecting 35% of the population, and it's probably going to be 50% here if we don't make some major changes in our country. And it's just become so common, and just it just and so I think it's important that we don't we don't normalize this. We have to say this is something that is um, um, we need to really make some changes. And in my opinion, this is about individuals and how we live and work in our society, and how we eat, and how we use our free time to try to stay healthy. And the benefits are huge, but I think it's a careful balance of course, benefits and risk. No one's perfect, but this is something that we have to, as a society, really work on.
Yes, Rob, that was a great description of metabolic syndrome and related disease. I would like to make a few comments. Number one is the processed food. The best combination, or you can put in every processed food, is three things: is salt, sugar, and granular fat. That's the secret to any chef. That's what make the food taste good, make and preserve. And unfortunately, all of these things are metabolized through the liver and causes the syndrome that we see. And as well as all the disease that I mentioned, stress is another big play on sugar metabolism as well as hypertension. And I'm very interested to see the data hopefully comes up since COVID, what has influenced people about their metabolic syndrome and disease. Because when I see our patient in the clinic, they gain more weight, they drink more alcohol, and sugar has been poorly controlled, as well as um, uh, putting their disease in the back burner, as the most physician for past year or so has been seeing more acute disease. And so I think the consequence of this to come out with the next few years is going to be substantial, not only for individual, I think as a whole country, as well as financial effect and burden over the health system going to be tremendous. If we don't do something now about it in future, it may cause bankruptcy of the whole health system. So as we are fighting with the food industry, and today with home food delivery, this has become more of an issue for most of my patients. But I think we need to get people back to cooking in the kitchen and taking their uh, charge of their health, and minimal exercise, at least 30 minutes a day, and choosing what they eat. I think is a huge uh, help to preventing all this complication, all this disease.
Boss, when you're in the clinic, it's Do you see the metabolic syndrome more, or do you see some of the? Could you describe some of the diseases that are associated that you see? It's certainly in oncology we tend to see, I think, kind of a later stage of metabolic syndrome with some of the cancers and some of the conditions that are late diseases associated with the metabolic syndrome. Could you describe a little bit about what you see in your clinic?
Sure. The metabolic syndrome per se itself has no sign, and that's one of the it's almost a deadly disease that is creeping without no sign and symptoms. It's not like muscle aches or other things. So it's a slow, gradual killer. And by the time we get to the all the manifestation, we have let it go. And many people they do not think of it as this as a whole um, uh, disease together. Of course, initially, what we see in the clinic is actually gastroesophageal reflux disease or gas and bloat, and then people continue to if they don't take care of it. Sometimes they get gallstones and due to fatty liver and obesity, and as the disease progress to diabetes, and then we get what they call diabetic gastroparesis that causes decreased empty stomach. So by the time you get to the fatty liver and cirrhosis, disease has progressively worsened. So the early symptoms that we see is possibly is the gastroesophageal reflexes, as I mentioned before. It's a dashboard. If something you eat, your body give you reflux or bloating, you need to pay attention. What you have ate is the what you're eating, what how much you're eating, and what time you're eating. So these are the early signs, but per se, this is like NASH or non-alcoholic fatty liver disease. Those they do not have no symptoms at the beginning, and as the by the time the liver enzymes goes high, um, and the primary care physician do an ultrasound, there are many years in progress, and by the time you get that is probably 8 to 10 years after initially of this disease. So in the GI side reflux, we see the fatty liver. The fatty liver is when there's excess of deposit of the fat in the liver cell. To a limit, liver can tolerate that, but once this progress more and causes inflammation, that's what you see what they call NASH. That's what the inflammation in the liver. And if this progress through the times, then we see scarring of the liver called fibrosis. And when fibrosis takes 15 to 20 years to go, then it causes cirrhosis and causes cirrhosis to liver failure, and with what you see possibly liver cancer. And today, unfortunately, we see um, in young people. I think the one of the youngest patients I have that is 32 years old that he need severe cirrhosis, need a liver transplant. And many of the people that says, well, don't drink alcohol, and they go through all things, but it's the lifestyle of setting the lifestyle on obesity, fast food, and processed foods like soda and many other things that cause that. So the common initially is to answer your question, reflux, but fatty liver to get cirrhosis, they have no symptoms, and that's unfortunately we see quite more frequent in our office. And I think by 2025 or 2030, you're going to be one of the leading etiology for liver transplant in this country. As we know, the transplant by itself is liver is non-availability of the donor, and so it's going to cause increased mortality in our patient.
Thanks, Abbas. And in the oncology clinic, we do see a similar set of conditions. The acid reflux, as Abbas mentioned, fatty liver disease is super common in oncology. We get a lot of scans, so MRIs and CT scans, and one of the easiest way to diagnose fatty liver is the abdominal ultrasound. Can easily pick up fatty liver. A CAT scan without contrast can also, you can actually see the density of the liver is different because of the fat deposition. So the radiologist can easily measure that by looking at the density of the liver tissue. And in oncology, we often see the later conditions associated with the metabolic syndrome, including different cancers. We talked last time about esophageal cancer and a whole host of cancers: breast cancer, colon cancer, pancreas cancer is also likely increased by this condition. And in my opinion, this is probably related to the inflammatory state that associated with obesity, insulin resistance, and what, there's a term called senescent cells. These are these zombie-like cells that, as we get older, they lose their function. They are not really they don't really look like the tissue from which they originally started, but they are just kind of semi alive, and these are the cells that probably lead to development of cancer. So with metabolic syndrome, we're likely supporting more and more of these zombie-like cells, probably through insulin resistance as a major factor. And of course, there's a variety of other conditions that are associated with metabolic syndrome. One of which I'm very interested in is the sleep obstructive sleep apnea. That creates this really vicious cycle of poor sleep. So what happens at night is the airway will occlude. That creates little disruptions in REM sleep, which is the deep sleep. So the person is waking up numerous times per night, maybe even 100 times a night or more, and sleep quality is poor. This actually results in a whole variety of different conditions, including heart rhythm problems, higher risk of high blood pressure and stroke, and inability to lose weight. This is actually very well documented in a variety of studies. Individuals who sleep poorly cannot lose weight. It's probably the cortisol and other pathways are really highly activated in those individuals. And so once obstructive sleep apnea starts, it's very difficult to reverse this without treating the obstructive sleep apnea first. So if you're having problems sleeping, definitely talk to your doctor and consider having a sleep study. This can be done at home these days. So there's really fancy home monitors that are available, and you can actually get a sleep study done at your house and send it back in, and you'll get a result usually within a week. So um, I thought it would be helpful to talk a little bit more about some of the ways to prevent this, and we talked about this a few minutes ago about prevent how to some of the ways to prevent the metabolic syndrome. I thought it'd be helpful to we can go through just some of the top line items, and maybe Abbass, could you when you're working with a patient, how do you start this conversation?
I will. I'm realistic with them, and I'll put some short-term goals and that they can easily achieve, and gradually increase it. I think one of the biggest uh, uh, cofactor or a part of uh, the whether it's reflux, fatty liver, metabolic syndrome, is the unfortunately the lifestyle. Today, people they jump out of the bed, they go to eat the donut or something in the way to work, and fast food, and come eat huge dinner, and then go to bed. And that I think is the pattern of eating. I think is has to do with a lot with early initiation of that, and with other diseases there. So at night, as you mentioned, sleep is very important, that we rest. You go sort of like a small hibernation, like at night. So if you can change simply the life patterns, eating a good breakfast with your fuel we need for our daily work, depending on what time you're working, just there, and then have a reasonable lunch. The dinner should be very light, because at that time what your body wants to rest, as Rob mentioned, was sleep apnea. If you're eating late at night and you have sleep apnea, the acidity to the esophagus keep wake you up. So consequently, that's make you not sleep. And then finally, when the food is fermented in the stomach and they have nothing to do, when they get absorbed and circulating in our vascular system, so then it causes a deposit of the plaque in the arteries as well as more fatty liver. Then consequently, people they don't want to eat breakfast, so it becomes a vicious cycle. So the sort of scheduling the meals is something can be achieved over 1 to 2 weeks. People adjusting that, and I have many patients that they could not believe just by simply doing that, the reflux went away and they're feeling better. The second is avoiding processed food, particularly soda. That's something can be substituted with water or non-caffeinated tea, and then subsequently making healthy choices. So avoiding eating 4 or 5 meals out a week to minimize it to maybe once a week, and then preparation of the food, some of the simple preparation that can be achieved and be realistic. And that's sort of how I approached to the patient, because initially this metabolic syndrome that most we see because of elevated liver enzymes is silenced. So people, they don't have no pain in the liver, they don't bother them. So and they say, well, I don't drink, and they think mostly associated with that, which majority of them is not have to do with the alcohol. Of course, the alcohol, drugs, many things can make it worse, because no matter what we do, everything that we drink or eat get processed through the liver. So beside the diet, the medication, the alcohol, as well as any chronic disease like chronic hepatitis C, they can all become a combination of this and consequently have a large effect on a person.
So we have this condition called metabolic syndrome, and we have the reality of our life, and there are some things we can control, some things we can't. And so when I'm meeting with patients, we often talk about, okay, what can we start to modify? What can we do? I think it's important to note that it's none of there's really nothing extreme that needs to be done in any of these individual categories. Just like when we treat high blood pressure, we actually will use two or three different medicines, oftentimes at lower doses. That often has better effectiveness and less side effects. You could do the same when you're trying to prevent or reverse metabolic syndrome. So the diet that Abbass commented on is really important. So a good general diet is Mediterranean diet, and we'll have a show about that, the different diets, and really define what Mediterranean diet is. I think it's that term is used a lot, but it could, there's various definitions of it, and we're going to delve into that a little bit. Exercise is really important, but it doesn't have to be that much. Most of the benefits of exercise can be obtained with about 15 to 20 minutes a day of moderate exercise. It should be what we call strenuous, but that doesn't mean you're collapsing out of because you're so tired after the exercise. Basically, what you want to do is breathing, so you can't really carry out a full conversation. You have to basically, between sentences or between words, you have to inhale. So that's what we mean by strenuous, and so that's about 50 to 70% of the target heart rate. It doesn't have to be that it's not intense exercise, but 15 to 20 minutes a day is highly recommended. Of and Really, it should be more than walking. Though walking is helpful, but it's very if you've ever used a heart rate monitor, it's very difficult to raise the heart rate significantly with walking. So it should be something a little more strenuous. Brisk walking can do it. Any type of aerobic type activity. Choose your activity that you like to do. Sleep and stress management are absolutely essential. So really, 7 to 8 hours a night is where you should be. That's something that just as humans we must sleep, and we'll do a whole episode on sleep here in the future. But sleep is fascinating. It's kind of like I kind of think of it like outer space or the deep ocean. We don't really understand it at all, what's happening, but it's something that all mammals do. If we don't do it, you will go insane and or die, and so it's actually essential for life. And there's a lot. It's a very active metabolic time. Actually, it's not. It's there's a lot going on with sleep, and it's something that's actually really really interesting. So sleep, stress management, meditation. There's a variety of different ways to meditate. You can do more traditional meditation. You can do more. There's a whole bunch of apps. I use one called Waking Up, which is very good. But there's a variety of different apps for meditation and different ways in which you meditate. This does not, you can do it online. It doesn't have to. It doesn't cost money. 10 minutes a day can be helpful. And of course, avoidance of smoking and alcohol is really important. There are some studies showing that limited alcohol is probably okay. There's others showing that there's no safe amount of alcohol. Use your judgment. The thing not to do is binge drinking is really really bad. Basically, that's associated with all sorts of problems: alcoholism, fatty liver disease, all sorts of metabolic and psychological issues with binge drinking. So certainly avoid that. And one of the things I've been thinking a lot about is this time of COVID. The last 2 years, we've been battling COVID and all the different uh, uh, lockdowns and different mask wearing and different disruptions of life. And um, I'm curious, Abbas, what are your thoughts about this, and how can we live healthy in this time of COVID? And it just seems that a lot of the things that we're being asked to do really are actually detrimental.
I absolutely agree with you. I think the metabolic syndrome pre-COVID was bad. Post-COVID going to be probably metabolism on steroids. And unfortunately, the whole like a tornado effect of this COVID, beside, of course, effect on the lifestyle and children not going to be able to go to school and not go to college and staying home, and then of course the um, availability of the fast food delivery, and then combination of stresses at home and increased alcohol and drug use, and has created a huge new phenomenon in healthcare. When I see the patient post COVID, sometimes they says, "Well, this is my COVID-10 or my COVID-20." Then you look at the liver enzymes; they went up. So yeah, I've been home sitting, nothing to do, watching TV, drinking alcohol. So all of that has become today's lifestyle, and it's gonna affect on our mind, body, and our future health. So I think we need to be realistic. We need to do a lot of things that what we can, not get COVID, at the same time be realistic. So as you mentioned, there's many things that one we can, you have time instead of watching TV, cook your own food. That's simple as that. That will decrease that. Minimize the alcohol intake. You can exercise at home. You can exercise with a stationary back for 30 minutes. They were just simply stretching and do yoga or Tai Chi position. And when it's whether it's suitable, going outside, whether it's walking, or brisk walking or hiking, and you can choose your vacation instead of going to a crowded place. Go, if the weather is suitable, go to camping, or other things. If you're close to the ocean, walking on the ocean. So there's many things, choices that we can do. Bicycling outside. So we need to really make a judgment, and not take the risks of going to crowded place. I think gym is one of the worst places that you can go it, in my opinion. So it's a crowded place. People, they get emotional, but I think you can do many many choices that, and put a realistic goal for yourself, that you can do this, and this possibly stay with us for another 4 or 5 years. So then that affect our health. And if you see any signs and symptoms, whether today with virtual health, you can communicate with your physician or health provider. So don't delay your symptoms. You can, if you don't want to go to doctor's office, you can do telephone, or or a video consultation. But I think we need to be realistic with this and don't get it more than what it is, because this will becomes probably 10 or 20 folds worse post COVID when you look at this whole array of metabolic syndrome, in my opinion.
Perhaps this is one of the longest lasting changes that we're going to see. And I said it before, but I think it's just so important to stress. This is really about the individual and learning how to live in this post COVID world. And it was an issue before COVID too. So I'm not blaming this all on COVID, but we're certainly most likely, I think it's fair to say, we'll probably see a higher rates of obesity and thinking of COVID as an accelerant in this case in terms of more metabolic syndrome and the resulting conditions. Well, we hope you enjoyed this episode, and please send us feedback. If you like the podcast, please subscribe and feel free to share. And yeah, we'll see you next time, and we'll have more discussion about lifestyle medicine. Thanks.
Thank
Bye.
you. Bye bye.